Rachel, thank you for joining me on GV Talks.
Oh, thank you for having me along.
You mentioned you're in Echuca yesterday.
In
Echuca, was it presenting or at a spiel?
I've been actually in Bendigo. I was in Bendigo.
Bendigo.
It was actually via Zoom. That was last week.
Oh, okay.
All on the pandemic and pandemic fatigue.
Yeah.
And languishing, and it's just, I guess, the impact of being in this kind of shared trauma that we've all been through with COVID, and on top of our usual lives and jobs. So, yeah, giving some professionals some help and bouncing off some issues around, validating that we're all feeling pretty tired. We've all kind of had some of that pandemic flux of kind of whiplash of in and out of lockdowns, and we're still sort of grieving, I guess, the loss of some freedom that we had, and still dealing with some uncertainty going forward in terms of what's the new normal going to look like, and just feeling a bit tired and I guess limping to the line at the end of the year. So
it sounds like you're describing me. How do you get the opportunity to present something like that?
Well, it's actually interesting that I've had a few people approach over the time, in the last 12 months actually, about I guess they've just noticed that I work as a psychologist, and they've noticed that I think that I've done some work in the area of stress and coping with people. So, of course, I've never been through a pandemic myself. I wasn't around in 1918 when the Spanish flu was on. But I guess I've done quite a bit of work in that space with helping people through, different stressful life events and dealing with uncertainty. So, so I had been approached, I think, sort of via sort of social media. People had been following and noticed that there might be an opportunity to sort of have me on board. So on I popped, and it's mostly been, which is unfortunate, it hasn't been in the room, because it's mostly been delivered over Zoom, but we had one locally, for example, Family Care had contacted me this year, and I did one last year for them, and we had 2 lots of sessions on pandemic fatigue, and we had 2 lots of 100 booked in for each Zoom session. So basically one in the afternoon, then one later that day, for a range of different professionals, educational providers. People just wanting, I guess, some tips on how can they, I guess, improve their self-care going forward, given
How awesome.
Yeah.
Before we get too deep into it, do you want to tell the locals who they're listening to?
Certainly can. Yeah, so my name's Rachael Willis, or that's my name I work under, and I work as a clinical psychologist here in Shepparton in a private practice called Pure Empowerment Psychology. I'm actually the managing director. I kind of describe myself as a life-juggler because I have quite a few different hats. So I have the role as the managing director at Pure Empowerment Psychology. I work in the office, and I also work in our outdoor office, which is down at a farm location near Euroa, with horses and people. I can talk a little bit more about that later if you'd like.
Yeah.
And then we also have a couple of other businesses here. So we have also a real estate agency, and the other businesses, we also have a farm. So I call myself a life juggler because I have a few different hats that I wear. But obviously today I'm talking to you more about the hat of psychology. And I work as a clinical psych, but I also work as like a supervisor to training intern psychologists, so that I can only see so many people, but if I can help them, help train up other people, then they can go on to help more people. So I sort of see my purpose is helping to reach as many people as possible, but not obviously directly via myself always. Yeah.
You don't know what you do, how it echoes. Is that what you mean?
Yeah.
How do you juggle all that stuff?
Good question. I have to be incredibly organised. So I have quite a strict schedule around, the days that I'm in wearing my kind of on the business hat with the director hat for the practice, and the days that I'm working in a clinic, clinician role, the times that I'm working as a supervisor, the days that I'm doing equine assisted psychotherapy at the farm, that's on a particular day of the week. And then, of course, there's also some guest speaking roles I have been doing as well, as I mentioned before. So it's about being organised and just being mindful which hat you're wearing. And then, obviously, sometimes I'll throw on the real estate shirt and help out with inspections or, auctions. I've got my full real estate licence as well, because my husband, Rod Seach, is actually a licensed real estate agent at Your Soul Real Estate. Yeah.
Great.
Yeah.
How do you feel about having a full schedule?
It's interesting. I like being busy. I'm kind of that, I need to be busy in some respect. I need to have a full, I don't say need, I like to have that. I thrive on having more things going on. I have to be careful because I can bite off more than I can chew. So I'm constantly checking in on myself. Like every quarter I do a kind of self-care plan, which I do with my staff as well, just to check on how it's sitting. I've had to get better at delegating as well because I'm very much pretty fiercely independent. So, I'll look at a project and I think I can do all of that, or look in a role and I think I can do a lot of that. So I've had to get better at delegating, and building team over time has helped with that. Yeah, so.
It is hard to delegate, especially when you're, how you describe, like somebody who likes to take a lot of things on. I find they're always they want to do it themselves. It's those two things go hand in hand.
Yeah.
So how have you done that? How have you let yourself become the person who can delegate?
Yeah. Well, I've actually had to just be, and sort of a strategy that we often use is think about, there's a part of you that's kind of the wise mind, the part that makes the reasonable decisions, and then there's intellectual mind and there's emotional mind. So emotional mind's kind of fear-based. Intellectual mind's like you should be able to do this and should be able to do that, not checking in on your energy levels. Whereas wise mind kind of goes, well, what would the average person be able to do? Would it be fair and reasonable? I expect them to do this, this, and this, in a given day. I think, no way, no one else would take that on. That's far too much. That might burn them out. So I guess I've allowed that part of me called the wise mind or the healthy adult to try and lead the process. And that's something I do with the clients I work with as well, is that healthy adult needs to be leader, not, the part of us that can be quite emotional or, vulnerable, or the part of us that can be quite intellectual, because both of those spaces don't allow for really checking in, I guess, what's healthy in terms of what's reasonable limits to put on yourself and your workload. Yeah. Yeah.
You want to be at the edge of your capacity though.
I sort of think, Harley, I've got a bit of an interest in sports psychology. I'll talk a little bit about that maybe later, but yeah, I always think about that inverted U of stress. So, there's up one end of the curve, you've kind of got down the bottom, of the axis, you've got like low stress on one end and high stress on the other. And then you've got performance, low and high. And for me, my optimal curve for performance is in my job and in life is about having more things. So more stress, more things to do to a degree. And then once I exceed that, that's when my performance will drop off. So it's called the inverted U of stress and performance, and it's quite a good one that we talk to people that in the sports psychology kind of field, that, and not just sports psychology, but any sort of performance area that you need to kind of work out what your level of best function or optimal function looks like. So for me, that is doing more than less. But it's also the type of work I'm doing as well, that it needs to be energy giving and vitality giving. If it's not, I need to say goodbye to that. So, yeah.
What do you mean by that, energy giving work?
Well, energy giving is meaningful work. So that could look like different things for different people. But if I thinking about taking something on and I feel a sense of vitality about that, for example, coming along to this interview, having me on. So if I feel like there's a sense of vitality that's actually would bring me a sense of contentment and fulfillment, that's something that I would and I can fit it in, obviously, in the schedule, then I would take that on. If it's something that I think that's more of a drain, I would be really doing it for someone else more than, myself in that respect, then I would say no to it in that, So, and I found that that's kind of worked. It works for me, and I encourage clients to live that life where you're pursuing your values, congruent with, that level of contentment, and fulfillment in life. Because otherwise it feels like life is hard, things are hard. So, yeah, the old saying is, around if you do a job that you love, you never work, a day in your life. And that's a lot to do with, I think the contentment and the fulfillment, finding that and sticking at that. I think that's really important.
It's great. I love it. I try and do where my interest sends me. Yeah. Which kind of feels similar to what you were saying just then.
Yeah.
So we're kind of going off track here, but I want to get into it.
Yeah.
If somebody isn't finding that in their work,
Mm-hmm.
do you think that they need to change job or just reevaluate what they're actually doing?
Yeah. Not always just change job or change school or course or whatever it might be. I think you need to step back and then look at basically what do you want your life to stand for? And it sounds quite deep and meaningful, doesn't it? But a lot of people come in to see me and they say, I'm kind of lost, or they may not even say they're lost, but they just feel lost, and they're just basically putting one foot in front of the other. So that to me is, it's not content, it's not fulfilling, it's not rich. It's just that they're ticking boxes each day and they're feeling a sense of being stuck. So basically looking at your life and thinking, well, I can only spend time in one space at one time. So I can either be at work, I can be in my relationship, I can be with my family, I can be with my hobbies. Let's really look at, where these areas of each of these areas of my life give me some sort of sense of vitality. So I sort of ask people to rate them, and I do this myself, is how important are all of these things to you in your life right now? And then how successful do you think you are in each of those areas? Because the bigger the gap between how important and how successful, that's called a reality gap. And that's in that space of that reality gap is where generally our discontentment is. Because we're wanting to do, let's say there's a particular, you're wanting to spend more time doing hobbies or recreational pursuits, and I just don't have time for that. But if you were doing that, it would give you more joy. There's a big reality gap between how important it is to you and actually what you're doing, how you're showing up in that space.
Yeah.
So basically in that gap, it's like, well, what are you going to do about that? Are you going to complain you don't have time to do that? Or what are you going to do to make that happen? Because I notice on the other area of your life, maybe it's work, you're spending a lot of time there, and it's going really well for you. But meanwhile, back over at the hobbies area, you're feeling like there's a bit of a discontentment. So, so allowing people to explore, I guess, their sense of reality gaps in their world, because it can be different to that, And as you move through your life, different things mean different, obviously have different values and importance. So your friends might be really important to you at a particular time in life, and they always are important. However, as you're tracking through life, you notice that the value alignments can change a little bit. So I think that's been very, very helpful as part of work-life balance and work-life harmony, more than balance, is to really check in on that discrepancy between what's really important and how life actually is in that space of that reality gap, and what are you going to do about that. In fact, it can be a reality slap, because when you discover it, you think, okay, I actually, why am I being this sort of rat on the treadmill, and I keep doing the same thing and nothing changes if nothing changes. So but we're creatures of habit. We continue to do the same thing, even though we talk about, I want to be doing this and I want to be doing that in my life, but I don't have time or we don't have whatever it might be. But the reality is we would make the time if we knew that was important, and then set some committed goals and actions towards that. Yeah.
Yeah, of course.
So, yeah.
My curiosity wants me to ask, what would happen to the society if everyone just did what they wanted? Because there are some jobs out there that nobody wants to do, surely.
Sure, yeah.
Yeah. It's that would be tough, I reckon.
Well, yeah, it's interesting you've said that, because I've noticed a real shift since the pandemic, and during the pandemic, is that people have really started to look at their values and say, you know what, I don't want to go back into work from 9 to 5. My employers allowed me to work at home because of COVID, but when the opportunities present to come back to work, I actually don't want to do that anymore, because it's not meeting my needs. Like I valued having that time in the morning, maybe more, time to sort of warm up into the day, exercise, spend time with family, etc. And I don't want to be doing that anymore. So this is where I think a lot of people have been confronted by that, and they're looking at their values. Of course, if you then go, well, I just want to live a life that's about entitlement and it's all about me, that's not going to work in terms of, So, but we do need to consider, what does a harmonious life look like for you, and that'd be different for every person. And then how do I manage that with the realities of what life expects of us, I guess, in our different roles.
Yeah, great. How did you personally get into psychology?
It's an interesting story. It's a well, I find it interesting in that I never knew I was going to be. I wouldn't have even imagined I'd be a psychologist. My story is this: is that I'm an identical twin, and so there's another one of me running around, but in Melbourne. So I'm actually from Melbourne originally.
Who's
and
the evil one?
The evil twin. Yeah. Oh, of course, my sister Belinda. And we're, being identical twins, you're involved in a lot of research and studies. And my mum and dad at the time, they thought it would be great to be, let's contribute to research. Let's put these twins forward. So we were involved in lots of studies. So I was literally from the ages of, I think it was around about 3.5, 4, right through to early teenage years. Basically, we would have psychologists coming to the house, bringing out the little testing caravan. It was like looks like a vintage caravan back in those days, because this is back in the late 70s to early 80s. I'm in my nearly late 40s. So anyway, and they would test us. I still remember sitting there, and I just remember a bit like your chest here, that we had the farm animals, and we'd be sitting opposite each other with a partition in between us, and we'd have to sort farm animals into little plastic fences. And then they'd be, have their clipboards out, and they'd be assessing how we had done that. And a range of different, obviously they did some cognitive or IQ tests and a range of different things. And it went all the way through until we pulled the pin, and said, enough, we don't want to be involved in this anymore. And I was just always so fascinated. And then usually the story is, when you're at high school, that there's the friends that, come to you and talk to you and those sorts of things. So there was a bit of that as well. At school, I generally kind of had I had my great peer group, and then I would float amongst other groups as well. And I'd always have this little bit of a bleeding heart for the person who was sitting outside the library by themselves reading a book every lunchtime. These sorts of people that you would see. And I now think that these people that maybe didn't quite fit maybe into other peer groups probably did have, maybe they were on the autism spectrum, maybe they were, there was a range of different things. But so my interest grew, and then I took psychology in year 11, and I was just fascinated by it. This is just really so interesting. Never did I know, though, that it was going to be such a big commitment in terms of study. At that point in time, I was taking the subject out of interest, and I thought, this is really interesting. But by the time I got to year 12, I still remember sitting with the careers counsellor at the time, and in those days they'd pretty much just have the job guide and they'd flip it open. And I still remember, because this particular careers counsellor or teacher, I think she was in this job as a bit of an optional kind of extra to her teaching load, I would say. So basically she flipped open the job guide, and she just sort of randomly selected and said, so what about a myotherapist? What about that? And I'm like, what's a myotherapist? I've got no idea. Yeah. And then she was saying, what about, something in the therapy field and, these different things? Because I really didn't have much idea. I think I was thinking I'd maybe do something in teaching, or so I had an interest in sport. I've been fairly sporty throughout my life. So I had an interest in sport and at VUT, and I was a little bit confused. Anyway, I saw behavioural science at La Trobe, and I thought, that looks good. Looks interesting, and it was amongst other things. And anyway, I ended up getting into that. So at La Trobe in Bundoora in Melbourne. And and at that point in time, I still really wasn't sure. I did the undergraduate, which is 3 years starting point, and then you get to it needing to do accredited fourth year. So you either get invited into honours. Well, the first 3 years of uni was pretty social, and it was great, involved in lots of different things. But and that's part of uni life. But anyway, so then by the fourth year, I was fortunate enough I sort of knuckled down more so in the third year, and I got accepted into the honours at La Trobe Bundoora, which was excellent. So then it was more research there, and I was like, I don't really want to be a researcher. There's so much stats and rats you can take when you're studying psychology. There's a lot of statistics. There's a lot of theories, and it's all very helpful. At the time, you question though, how is this going to help? I just want to work with people, and it's not until you get to the fourth year you start to sort of do a little bit more of that practical work. I also at that point in time thought, if I'm going to work as a psychologist, I better find out if I actually can do this. Like, I know I can read a textbook and I know I can sit an exam. So then I went and I did some voluntary work because I thought I really need to find this out if I want to pursue this further. Because I'm not, at this point in time, I'm, third year, then into the fourth year, you're not a psychologist or a trainee or provisional at that point. So then I just ventured into doing kids helpline and crisis lines. So they're, after hours, mostly on after hours, and teaming up with a couple of other uni students, and we'd be rostered on all around the clock, which was interesting. And it was great. We were after hours for parents of missing children line, and you'd hear so many very confronting stories, and people ringing in need, and then we'd have people pranking us, of course, because they're testing out the service, particularly on Kids Helpline. And I also did a bit of helping out with Berry Street, and not fostering, but also just helping out with their Big Sisters and Big Brothers program, and that was another good way to sort of learn. And then I thought, I'm really enjoying this, so if I pass everything, which, it's looking okay, hopefully I can find a job somewhere that's in a broad field of psychology of some description. And hopefully I could find an internship, that would be even better, because back then, it's cutthroat to get into psychology courses, particularly if you're going up higher postgraduate. So after your third and then fourth year. So I then, found this job in disability services. It was out in Thomastown in Melbourne. So it was working in an old police station. It was the old cop shop in High Street, actually, in Thomastown. And it was actually very similar demographics to Shepparton, actually, in terms of cultural backgrounds, that sort of area. So I enjoyed that work. It was helping people sort of find work, vocational rehabilitation sort of service, who have a multitude of different disabilities, from physical, so not just all psychiatric or mental health related issues, but physical, people who are hearing impaired, all sorts of things. So so I got that job, lined it up, got a supervisor, and started my internship, which is a bit like an apprenticeship, I guess. And back then it was a 4+2 pathway, which what that means is you do 4 years at uni, 2 years on the job.
Yeah.
Okay. And I was just so fortunate. That job, I really enjoyed that job. I had an awesome supervisor, and then 12 months into that, I was offered, where my supervisor was working at that time, to join the team. Well, there was a job that came up, and he said, "Rachel, I think you should really apply for this." So I applied, and I was successful in getting a job, and it was the National Employment and Psychological Services Centre in Northcote, in Melbourne. And they had a few branches within Australia. So one up in Brisbane was their head office, but my work was in Melbourne. And that involved doing all sorts of things. We helped people not just get work with psychiatric disability, but we also went into services in the city. So we went into Department of Veteran Affairs and the Bureau of Meteorology, and we used to do a lot of training with the staff on mental health, kind of like first aid.
Yeah.
And and just staff support. You'd kind of walk through the hallways and find yourself a cuppa and sit in a room, and people would just come and have a chat if they needed that kind of stuff. So so there you go. So and then I finished my internship, and I had my official, then I had my provisional P plates off, because you're a provisional psychologist first, and then once you finish your placement, if you like, plus your supervised practice and all the other tasks you need to do with it, then you get your full registration. Yeah.
So how long was that part of the journey? 6 years?
6 years, so the 4+2, yeah. So they're actually, though, retiring that pathway. So when I went through, because I've been a psychologist now for 21 years, so they were going to retire that pathway back in the year 2000.
Yeah.
So I had to work quick smart to get it done. Here we are in 2021, and it's being retired in 2025.
Okay.
So, yeah.
Psychology is one of the most popular courses these days. And you said that you help people through their apprenticeship or
your internship.
Internship, sorry. Yeah. Do you find like a lot of people drop out of that course?
Yeah, it's actually the first year of the undergraduate, because people are expecting, so this is the first year of the three years before you do your fourth year, people are actually expecting that you'll work with clients, and you don't. It's far from the truth. You know, you're doing lots of research-based theory, you know, as I said, statistics and, as we say, stats and rats kind of stuff. And people are just really eager to start working with people, but you have to understand the fundamentals of human behaviour and the theories and, you know, and the range of different mental health, not just mental illness, but the continuum of mental health, from, you know, what health looks like and what illness looks like and psychopathology looks like. And then obviously the different lifespan stages and what that looks like across from infant mental health right across to older adult aged mental health. So, and then all the different types of psychology, like, you know, it's so overwhelming because you think, well, what do I want to be if I'm a psychologist? Because I'm trained as kind of a generalist, and then we're not really allowed to use the word specialist because we're not a medical doctor. We don't have a medical degree like a doctor or a psychiatrist, for example. But, you know, your special interest might be sport, or your special interest might be clinical psychology or organisational psychology or child, you know, educational development psychology. So, yeah.
What psychology do you unofficially specialise in?
unofficially, okay, yeah. So I'm branded as a clinical psych. So my background is, so I'm trained as a clinical psychologist, and so I was a general. Obviously, after my pathway, I became general psychologist, and then I went off and embarked, and I worked for a while because I was like, I want to get into the real world, and then I then did a master's in clinical psychology. So clinical psychology, all that pretty much means is that we're trained across working usually with people across the lifespan. Generally, you'll see a clinical psychologist in more of a clinical setting like a private practice, a hospital, yeah, but they can be found anywhere, okay? And generally, we're trained quite rigorously in assessing and diagnosing people. So we work fairly closely along psychiatrists as well. But obviously we don't have prescription privileges, so we can't prescribe in Australia. Yeah. In America, you can. In America, you can, but I
thought you were a doctor if you're a psychologist.
Yeah, so I know you don't get the doctorate. So here's my saying I was a twin. So my twin sister, she went and did vet science, right? And she gets a doctorate title after, which is fine. But the pathway, I mean, I've done 10 years, I'm not complaining, but I mean, if it's 8 years to be, to then find a special interest area, you still don't get your doctorate until you've completed it. You have to go and do a doctorate. Okay, so some professions in health, you'll just naturally get the doctor title by just completing what's required in that training they do initially, not in psychology. And that's why it takes a long time to become registered. And then there's waiting lists for psychologists, because trying to actually train psychologists, for them to get into courses, for them to be trained and then graduate, like, it's such a long process. Yeah.
You would know the medications that people need to be prescribed for certain mental health illnesses. Yeah. So you just refer that on, really. So really...
Yeah.
Same.
Yeah, we refer them on. And I mean, most of the referrals we receive anyway, Harley, are from GPs. So you don't need a referral to see a psychologist. So that's a big myth. You can just ring or you can email and you can see a psychologist. But if you want to get a Medicare rebate, you want to go on a mental health plan, the doctor is the gatekeeper. So they would go to the doctor first. And most people find themselves in a GP room first before they see a psychologist, talking about, I can't sleep, or I'm feeling whatever it might be. And then the GP will kind of go, well, have we ruled everything out? Like, is your iron okay? Or are there other biological factors? And if that all comes back okay, they're like, well, you're still feeling tired, you're still having a lack of energy, or feeling a bit of sense of, discontentment, maybe there's some depression or maybe some anxiety or whatever it might be. So, so then that's where the referral is facilitated. Yeah.
What percentage of Australians have mental health problems?
It's a good question. So, so mental health, and I don't necessarily like the word mental health, or mental illness. It's a brain health, isn't it? When you think about it, but because it's still a bit of a stigma, and we're trying hard to change that. But What percentage? So, roughly it was 1 in 5.
Yeah.
Roughly. In saying that, though, the interesting statistics around mental health issues, I guess we break it down to lifespan. Children and adolescents are really featuring as having more mental health related issues because of this whole pandemic than we've ever seen before. Like happy-go-lucky kids really struggling, and some people that have had a history of anxiety, etc., prior to the pandemic can go, oh, actually, I can tolerate uncertainty okay because I've been dealing with it for years before the pandemic. That's what anxiety is, yeah.
Mm-hmm.
So the percentages, usually it'd be less than it'd be more than 1 in 5 now. I'm not exactly sure how many, but different mental health issues affect different people and lifespans. Like some females are affected, for example, more by depression or anxiety than males, for example. I know, unfortunately, suicide rates. I know that interesting stats about those 2020 suicide rates. It was 1 person dies by suicide in Australia. 9 in Australia. 9.1 die a day in Australia by suicide. Now, there'd been a slight decrease in that last year, which was interesting, given that we're in a pandemic. We don't know what the census and the stats will say, obviously 2021, but 2022 will obviously be interesting to see what that says. But we've definitely seen an increase in mental health presentations, but not necessarily, which is good, ending up in death by suicide, but it's still too high. 9.1 people a day in Australia dying by suicide is still too high. Mostly men is higher than females.
Do you think you know the answer to the problem?
It's a good question. The answer, I think, it's not just about psychology, of course. I actually think that there's a like I was talking about before with lifestyle and people choosing value directed, living and reality gaps, and I think lifestyle has an incredible impact on people's mental well-being. And if people were able to look at their habits of sleep, like exercise, routines, I think that says a lot. It says a lot because that just puts so much in people's coping bucket to offset the stresses in life. We're always going to have stresses coming along, but the coping bucket needs to offset that, okay? We've also seen people's temperament and personalities become a little bit changeable. So you can be, you're either more kind of wired to be more of an anxious worrier type, or that kind of, they say, like an awkward flower, quite sensitive and, worrier. Or you're going to be more what's called like a dandelion, kind of flat weed, just duck, water off a duck's back kind of personality. And it appears over time that we're probably having more people that are a little bit more that awkward flower, and that doesn't mean they're weak or any of those things. What it means is that their sensitivity for distress is a lot narrower. So basically they don't tolerate, waiting or tolerating, missing out on things. So this sense of distress tolerance has actually reduced over time, and that has a big impact. That people, it's a bit of a click and go generation. People get this, they want this now, and they feel entitled to it. Why can't I have that? So if you ask me, it's a little bit about that. It's about their temperament and their stress tolerance has reduced over time, but their sense of entitlement might have increased in some situations. The other thing is the happiness trap, which is a term that's used by Dr. Russ Harris, who's an ACT, acceptance commitment therapy, sort of originally a GP, but then went off more into the therapy. So the happiness trap is that, people often say if they're coming in, the goal for treatment, so we ask about goals and work on those, I just want to be happy. That's an impossible goal, because happiness is only one human emotion, okay? And if you look at the continuum of mental well-being, we're going to slide up and down it. We're going to be, in some stages we're going to be really struggling and or just, head above water. And other stages we're going to be feeling like we're really thriving. But to sort of say I want to just be happy or thrive all the time is an impossible goal. So the happiness trap is set up paradoxical by saying I just want to be happy. Now my life's not like that. So again, that reality gap. But okay, what if we could just tolerate, grief? What if we could tolerate uncertainty better? What if we could appreciate what we have, and that's what the pandemic's taught a lot of people, is appreciating what we have, in our lives now versus what we want, gratitude. What if we could be more compassionate about things, So I think it's a big, it's a big area. Mental well-being is, there's so many variables there that impact on it, and it's like servicing a car. It needs constant maintenance. Yeah.
I love the message, and I love everything you just said, but I find some people don't want to help themselves.
Correct.
I see it at the gym, like obviously if you start moving your body, you're going to feel better in yourself. They don't want to do that. I'm not asking them to do anything hard. Just come in for a walk if you want.
Yeah, and it's like if having a gym membership, do you actually use it? So I go to see a therapist. Do you actually come along? Do you see the therapist? Oh, I'm seeing the therapist though. So it's interesting you say that, because I use the analogy of going to a gym in my work with clients. I'll say, generally we kind of see 3 types of people come through our door, sort of 3 categories. We see the people that are willing and able. So they're at a point where they're really ready to take action. And the able part is that they're actually able to sit with the stuff that comes up, because therapy is not easy work. It is, it requires, sitting with unpleasant feelings, talking about things that may be triggering, okay? And obviously our job is to cause no harm and to help people through that and make sure they reset before they leave. But the reality is we're not doing friends therapy, okay? We're offering a dynamic approach, whether it's cognitive behavioural therapy or ACT, acceptance commitment therapy. We're trying to give people an outcome, okay?
Yeah.
So the people that come in that are willing and able, they are going to usually find that they'll, we do between session tasks, probably like yourself, do some training in between. And I say if you were just coming in to do your fitness assessment, for example, and you didn't do any training, or if you just went to the gym every time and left the treadmill on a 1 out of 10, and then we come to do the fitness assessment, you'd feel comfortable when you're training, but when you come back to actually do the assessment, have you made any progress? Yeah. So we've got these people that are in that willing and able, then we've got the people that are willing and unable. So they're coming in, but they're not quite ready. That they don't want to sweat on that treadmill. They don't want to, but they're there. They've got the gear, they're coming in, they read the things you might give them between sessions, but they're not quite there to kind of take it on. But they're still there, a little bit more motivated. And then we've got the people that are unwilling and unmotivated. So they're the people that are referred sometimes by, maybe it's by a meaningful partner or a GP or someone who thinks it'll be a good idea. They really need to get fit, emotionally fit, if you like, and they just don't want to, So they're just disengaged, and we're pretty quick to pick that up in a kind and compassionate way. To say, like, you're coming in, you're spending money on this service. Is it the right time to invest in this for you? When you're in because maybe your mum wants you to be here, or your wife or your husband or whoever it might be. It's okay. You're not mandated to come in to see us. We're a voluntary service, and you're paying to come in. So we want to see some outcomes. Yeah.
Even that person though would get something out of the session if they, even if they didn't want to be there.
Yeah.
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 I've got one client who comes to the gym and he's forced by his parents. He's a young kid, and our sessions are fine, and he enjoys some of them, but some of them are grueling. Like they're a bit of a task for him.
Yeah.
But even though he doesn't want to be there those days, he still gets something. I still get him moving.
Yeah.
And he often feels better afterwards.
Yeah. Yeah, it definitely. It's planting the seed.
Yeah.
And so if the person in your room or in your gym is not quite ready, I work with the part. I say to them, so you're here. Like, did anyone pay you to come in? Because you're actually here. And they'll be a bit of a chuckle. And it's like, oh, yeah, Mum. Did Mum or Dad drag you in here? Because you're actually here. So well done. How much have I got to work with? So I really want to know, if 90% of you doesn't want to be with a psychologist in this space, and 10% does, then let's work with the 10%. What's that 10% about? And this is called motivational interviewing. It's about helping roll with the resistance, but at the end of the day, my job's not to debate with them to say you need to be coming in. I'll say, this is what we can offer. This is what requires in between sessions to do. If it's not suitable to meet in the office, come down the paddock and work with me on the farm, because that approach with horses, you know, if this is confronting sitting opposite, we'll come to the farm, and we won't sit opposite. We'll be looking with the horses and working in that space. And you can fake it with the therapist, but you can't fake it with a horse. The horse will pick you up, and it will mirror back to you what's going on for you. So if you're having a time where you're feeling quite shut down, and you're trying to approach that horse won't give you anything. It will shut down. Okay. If you're feeling anxious, that horse will get a bit flighty, perhaps. If you're feeling, you got slow movement in yourself, that horse will move slower. So, if you've got hyperactivity, you have an issue like ADHD, and there's lots of energy, there's going to be lots of energy with the horse. Yeah. So the horse is a co-regulator. It picks up your heartbeat from 10 meters away. It reflects back to all of us what's going on. And when you say, what's wrong with that horse? I say, what's going on for you today? Because that horse is picking up. It's picking up on what's going on for you.
Is this something you've discovered or something you've researched?
I've actually, I do have an interest in horses, but in using them in a psychology space, I have done some further training I'm an accredited equine assisted psychotherapist. So I trained with people from America when they came out, when you could go to workshops, remember those days, and they come out to Australia once every 12 months, and it's IGALA is, they're based in Ohio, and basically you're trained to be, you're a mental health professional, and usually you have an equine person there too. I have a background with horses, so I can be both, but usually we try to have both if we're doing that model, to the protocol. I always wanted to be able to somehow interweave animals into the work I do, because I like my dogs as well, and I have a visiting therapy dog, but I find animals just offer another dimension, and you get, you can spend 1 hour in the therapy room with a person, you spend 1 hour in the paddock with the person and the four-legged therapist, and we found like 1 hour with them is nearly equivalent to 3 hours in the office. Like, there's just so much that comes out of that session, for all sorts of reasons, because the horses they're non-judgmental. As I said, they are sponges and mirrors, so they reflect stuff back. They co-regulate people. People start developing stories about the horses. They say, that one reminds me of my dad.
Yeah.
Or that one's like, my teacher at school who, blah, 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 whatever they might say, it becomes a story. And even the whole space you work in becomes a metaphor for their life. Like, people have issues with boundaries and setting boundaries around their self-care. They look at the fences, and there's issues with, someone's fences and boundaries and different spaces they can't walk through. And so it's all of that in that space. It's just, there's so many elements to it. So, yeah.
Yeah, being in an environment that they're not used to would bring like some of their unconscious thoughts out of them.
Correct.
Like, that's what it sounds like you're saying with the fences and stuff like that.
Definitely, yeah.
Yeah, but when you're in the room, you don't see the walls as boundaries anymore, because you spend so much time in these rooms.
Exactly. And 80% is unconscious, 20% is conscious. So in that space, you're tapping into some of the unconscious, unconsciously unconscious. And basically you're also in what's called experiential. So, if you're learning to drive a car, if I just said, here's the book, this is how you drive a car, would you know how to drive a car? It's like, well, I could read the manual. Okay, get in and drive. Like, let's learn how to use them. For example, learning how to drive a manual is quite complex to understand. So we don't just read, we also have to experience something to really understand it. When you're in a room with a person, we can do some experiential things in the office where we ask people to, maybe do a relaxation exercise or a mindfulness based, or I might do chair work where they are speaking to different parts of themselves, like I was talking about wise mind and the vulnerable child and what would the healthy adult say and all those sorts of things. But when they're in the paddock with the horses, it's completely sensory, it's completely experiential, And in that space, that's where change occurs, because you're tapping into mind and body on a completely different level to what you do in an office space. So, yeah, there's so many positives about it. It's not for everyone, because some people, have allergies to horses. If they have a fear of horses, that's not an issue. We can work with that. We have small little ones and bigger ones, and we just do a graded exposure to different, horses, or we just spend time observing them before we go in with them. So it's a really good space, and it's a great space for me because I enjoy being outside. Like, who wouldn't? I mean, it's offshore in 40-degree heat or it's raining. Well, we have a little shed there. It's the old shearing shed we've converted into a waiting room, so we can sit in that if we need. But yeah, it's really nice for all of us being outside. Yeah.
Is it a popular service?
It is. It's actually getting a little bit more. A lot of people don't understand much about equine assisted therapy or psychotherapy. They think it's about going to hug a horse, or they think it's about riding. We don't do any riding, I need to say that. It's all based on the ground together. Yeah. Horses are free to move, and we've got bits of equipment that we say, if you want to use this to lead the horse. We actually don't use any horsemanship terms. It's all what we call based on our clean language, and that doesn't mean we don't swear. What it means is clean language is that we don't want to bias the client's perception or the person's perception of the space. So if they say, that horse there, what is that horse, a male or a female? All right, because if they don't know horses, the terms are gelding and mare. I don't use those terms, so I just pretend I don't know anything about horses. It's a client story. So I'll say, what would you like them to be? I want that one to be a female. Okay, it's a female. And then they'll say, Rachel, what's that horse's name? And of course they all have names. We actually don't tell them the horse's name. And it's not, no, we say this right from the start. Because again, it's biasing that experience. So if I said, this one here is Harry. And if Harry was someone in their life that they've had some negative, issues with, all of a sudden they don't want to work with that horse because its name is Harry. Okay. So we allow them to name the horses. Or if they're names of people, or if they're even characters, or if I've had Harry Potter characters, I've had, you name it. I've had even people working with addictions, like for example trying to quit smoking, and they'll say that one's chemical addiction, that one's psychological. We've talked about these terms, but they've called them different types of addiction and social addiction. The horses have been called different things. And the horses that approach them tend to be sometimes the ones that they're having the most difficulty with. I'm having more problems with the physical side of that addiction than the social part. And the physical horse is closer to me. It's quite fascinating. So, so a very clean language, very unbiased space, client story. Mm.
So what I'm imagining is I come and see you and I do one of these sessions, whether it be in the practice or with the horses. And you sit back and maybe ask some questions and you observe, and then you give me some outcomes. So like you tell me, like, can you give me like some specific outcomes? Like what sort of things would you say to me if I was dealing with anxiety? Yeah,
sure. So firstly, what we would do is we would have the first session anyway. We generally, if you were coming, it doesn't matter if it's coming to the office or down to the paddock, but we normally have you at the office for the first appointment. And we talk about like what are there's the referral, the doctor said you've been referred for anxiety. Let's explore it a bit further. Is it actually anxiety? Is there something else going on? What type of anxiety might it be? So is it generalised anxiety where you just worry about lots of stuff? Is it more social phobia? Is it more OCD? So just qualify that a bit further. And then collaboratively what would the outcome look like? What would we like it to look like? If you were functioning better in yourself, what would you be doing more of, less of, and getting rid of? Okay. Writing those goals down, and then looking at, let's then put some sort of plan in place. So in the office, if you're doing cognitive behavioural therapy, we usually start working on behaviours first. Okay, so let's look at some particular behaviours. So with anxiety, avoidance is a key behaviour that keeps the problem going. The more you avoid, yeah.
Like for me to show you the anxiety, I need to have the stimulus for that. Like, how do you see that if we're in the in the room? In the room, sorry, yeah.
Yeah. So when you say you need to see the stimulus, so we'd sort of qualify what is the trigger for your anxiety. If you're aware, like is it standing in front of people and giving a talk? Or for some people, like with anxiety, if social anxiety, they really worry in that first part before they go out. Like they love going out, There's the anticipatory anxiety where they're really like, you know, building it up as to, you know, what might happen. And then there's the during phase, and then there's the after. Yeah. So anticipatory anxiety. So I'd really want to know what stage of it, which point, which phase of anxiety is most debilitating, if you like. And then I'd kind of case formulate. So, okay, so the trigger is, you know, you're waiting to go out and you're thinking all these things that could happen, might happen. Yeah. What ifing, negative what ifing. And then, and they're usually negative, obviously, outcomes to that. And then what do you then do? So then how do you cope with that? Okay. So look at their coping style, what they're doing, and then what the outcome of that is. And then I do a case formulation, and I kind of go, okay, these are your issues you've come in to, you know, get some help with. This is your history. These are the kind of the genetic factors or the predisposing factors. These are the perpetuating factors. These are the perpetuating boxes, the most important. This is what makes the problem continue. It feeds it. It puts fire, you know, fuel on the fire. So if we're going to then develop a treatment plan, we need to target what keeps this problem going, if that makes sense.
Yeah.
Yeah. And that's where the goals, and we develop a hypothesis, and that's where the goals to treatment. So then when we're going into the paddock or into the room, we're making sure we're addressing those, going through that treatment plan according to those goals, and then measuring if there is a difference. So for someone who spends a lot of time with anticipatory anxiety, I might be delegating them worry time. They're like, what? You want me to worry more? I said, yeah, paradoxical. If you worry more, you'll worry less, you know. So, but I want you to, when you're in that anticipatory stage, I want you to keep a bit of a log for what's going on. You know, what are you thinking? How are you feeling? What's your behaviour? And then bring it back into me. Let's have a little look at what's going on, because I don't really know what to change or help you to change until I know what's really going on.
Do some people come in and want the answer straight away? Because usually the relationship with a psychologist is how long?
Depends on the nature of, good question. Depends on the nature of treatment, that what they're receiving. So if they're receiving cognitive behavioural therapy, it could be a treatment plan of, you know, 12 to 14 sessions, 1 hour sessions over a course of time, if they're coming in fortnightly, month, and branching it out. If they've got more than one issue, which, let's be honest, most people in their life haven't just got one thing going on. There could be some other things that we say, well, okay, let's just focus on one thing to start with. But it could be longer than that. It could be longer term sort of treatment, like a few years, which then they start just coming in for maintenance appointments to kind of, you know, they kind of know what they need to do, but they're coming in for sort of a checkup to go, okay, Rachel, I haven't gone right back, but I've kind of taken a step back, so I need to kind of check in again, or something else has happened that's triggered them.
Like, I'm interested in seeing a psychologist, but I feel like I've got well-balanced emotions and I'm in a good place in my life right now. But I would just like to talk to someone who is unbiased, and I feel like maybe I've got a little bit of repression from some stuff when I was younger that I would like to talk to someone about who was qualified and could kind of like give me like what their thoughts on it and stuff like that. Do you find people who are just your average Joe coming in these days?
Absolutely. Or? We would see more so, Harley, most people as the average, as any person coming in. And because people are reading things, and, you know, as you track through life, different life events occur, and then it can trigger stuff in us, and you go, where was that from? I didn't think I was, you know, still upset about that. And then you try to make sense of it. And I guess a lot of people we see have already tried different things. They may have a whole bookshelf of self-help. You know, they've read everything again, like reading the manual for driving the car, but they haven't got into drive it yet, if that makes sense. So basically, we see more of that, you know, and I guess pure empowerment psychology is all about empowering people to be the best version of themselves. So we're very much about, it doesn't bother us what particular thing, because people say, oh, I know you've got a waiting list, or I know it's hard to get in, but I feel like my issue's small. It doesn't really matter. Don't worry about us. You've got something that you're actually being triggered by, or you're trying to make sense of it.
Yeah.
Let's see if we can make sense of it together, you know, because sometimes you don't really know where to start, you know, and that's where I guess we've received the training in helping people explore where these things might come from, but we can't change where they've come from. We need to change our relationship to the story and our core beliefs about how it then, I guess, influences the world that we live in. Because I think any life event that we've incurred over time, it can either sit there in like it gets stuck, which means it's kind of hasn't been integrated, and we keep having these kind of thoughts about it and it evokes feelings, which is triggering, or somehow it's moved from being, stuck to actually getting to being integrated, and we give it a sense of meaning. Now, once something has a sense of meaning, it doesn't get stuck anymore. It actually, it's the event spoken about, and then we actually don't feel so triggered by it. We still remember it, but we don't feel so triggered. So yeah,
it was so strange for me the other day, Rachel. I was I knew this thing had happened in my life, but I'd never spoken about it, and but I knew it in my head. But one day somebody asked me something that made me answer with this story, and when I spoke it out loud, I just started crying.
Yep.
Do you know what I mean? Because I'm just it sounded so much sadder when I was saying it to somebody. But when I knew it internally, it was fine.
Yeah.
But then once I'd said it to somebody,
gave it words.
Yeah,
you gave it words.
It was just gone. I feel like I was much. It was gone.
It was helpful to release it.
Yeah.
Yeah. It's and the crying part is completely. I know, sound cliche. It's okay because there's people don't often understand this, but when we cry, it's cathartic. We release. Yeah. It's similar to when sometimes people feel unwell, like nauseated by a particular trauma memory. Sometimes they go, I feel nauseous, I feel like I want to vomit, but they don't really. They might want to vomit. They may vomit, but that's a natural way our system is. That it's like when you go and have anaesthetic. It's pain, it's an emotional pain, and we get a sickness response from it too. So yeah. So I don't know if I've gone off a tangent there, but pretty much. It could be anything you can notice that's impacting on you, and that you can't nut it out yourself. We don't have the answers, but what we do is we say, let's bring this into this space and let's see what comes out of this, and I'll help you to the best of my ability. There's no guarantee with any treatment, and we never. And if someone ever says to you, "There's a guaranteed outcome," please run a mile, because there's not. Because there's so many dimensions to, as I said, mental well-being, which is outside of our office. We're just that one space for putting some things into your coping bucket. But if we can help you understand yourself, and I think that's the first part, is understanding what it is about me that triggers me, what is it about me that's healthy coping, because we all cope. It's how we cope.
Yeah.
I saw this, I've seen it with the pandemic. How many people would continue to go out to buy toilet paper excessively and hoard buying. It's coming from a scarcity mindset. Scarcity is from anxiety.
Yeah. What
if there's not enough? What if I don't survive? So how's that mindset of scarcity serving you going forward in your life? When there's a next time of uncertainty, you're going to go out and do something avoidance style coping again as a way of trying to manage that feeling. Let's talk about the feeling. Let's talk about how that mindset's helpful for you. Because scarcity is not helpful.
Yeah, definitely.
Yeah.
I'm not sure if this is true. You'll be able to tell me, I'm sure. A lot of psychologists see psychologists.
Yep. Very healthy.
Yeah.
Yeah.
Just because you're taking on so many problems, and you need to make sure you're in the right spot to handle that.
That's right. Yeah. You do. Look, ethically, so a couple of things. So when you're training to be a psychologist, they recommend that you do your own therapy to sort out any things that might be triggering, that a client might come into the room with, that you need to, or that will impact on that experience for that client. Because at the end of the day, it's not our session, it's the client session. So we've got to be very mindful, and that we're human being in that space with that client. So we're witnessing lots of traumatic stories, but not always traumatic stories. But sometimes you just don't know what you'll be triggered by. Ethically, we're required to have supervision at least. You're meant to have at least 10 hours, like 1 hour 10 hours a year, which is not that much, once every, 6 weeks or so. But that's logged in terms of your registration every year. So you have to complete so many hours of professional development to keep you upskilled. So you're using current evidence in your work with clients, but that you're also checking in on your own sense of health. There's notifications. A psychologist can report another psychologist if they're concerned about their mental well-being.
That sounds like a good thing.
It's a really good thing. So they're not just being notified based on being unethical in their behaviour. The clients can make notifications too. but psychologists can, notify other psychologists if they're concerned that they're functioning or it's impactful on a client. Okay, now every year when we renew our registration, you need to be able to tick, you do a declaration to say, I haven't committed any criminal activity, et cetera, et cetera. And if you are, have anxiety or depression as a psychologist, you need to prove that you're actually being, treated for that. Okay, so all psychologists should see psychologists. That's tricky. Or if it's not a psychologist, at least someone else who's trained in mental health. So it could be an occupational mental therapist who's mental health trained, or a social worker who's a mental health, has a background. But basically, some psychologists worry about seeing psychologists if it's a small world. They shouldn't be worried about that. I mean, I've treated psychologists before too. I've been to psychologists. I think it's still under the client, confidentiality. So you're presenting to the other psychologist, not with your psychologist hat on, as a person, as a human, who's open to absorbing all sorts of things about vicarious trauma, have your own life experiences. So yeah, we're not immune to any of that. So, and I think that's the pandemic's been a really interesting space, because I think it's been the first time that I've noticed I've been in a shared trauma at the same time as the client, and they're like, oh, I don't know if you've noticed, Rachel, but these lockdowns are really impacting. It's like, I know. Well, and that's where I've found I've actually received, like, we see psychologists, but we also have supervision as well. And they're sort of two different things. So therapy is different to supervision. Supervision is checking how you're working with clients and these sorts of things. So another psychologist is kind of overseeing your work, and it's de-identified and all those sorts of things, just to check that everything seems to be going quite well, because we all have blind spots,
Yeah.
But yeah, I've noticed I've definitely been using those spaces more so during the whole pandemic, because it's like, I'm feeling more tired. I'm not immune to any of this. So yeah, I need to cut back my workload a bit. I need to go and see people more. And it's worked really well. Yeah.
Who would you encourage to get into psychology?
In terms of what sort of person?
Yeah, like what characteristics? Like, if let's say somebody's listening right now and they're interested in doing what you do.
Yeah.
What advice would you give them?
Yeah, good point. I think, the typical personality profile of a psychologist is quite introverted person, who's more of who's got more of feeling based than thinking based, so who's more emotion based than sort of thinker based, and good on problem solving. I definitely encourage, it's open for many people, it's not, you don't have to be, people often say, oh, you've got to be so smart to be a psychologist, you have to be so intelligent. You need to have, average, IQ and common sense. I think you need to have your stuff sorted, so to speak. Your linen press, I call it, organised, meaning, the cupboard, that whatever your past stuff has been about, that you've had that sorted, that, when you're not doing it for another reason, you're doing it for the betterment for the people that you're helping, because some psychologists, well, not just some, helping professions can attract people that, maybe they're trying to answer their own stuff in this, and I'm thinking, well, go and do more therapy then.
Yeah.
Don't bring someone in the room around that. Does that make sense?
Mm-hmm.
So, but yeah, I think it's open to anyone. I think if you're a bleeding heart, you have to be careful, because you'll be a higher chance of vicarious traumatization. So, taking in people's stories.
Yeah.
One best, and it still resonates for me, is that one best statement of advice my intern psychologist supervisor said to me was, he said, Rachel, when you meet with someone, you're in two bubbles. You're in your bubble, they're in your bubble. Neither should the bubble ever merge. You're watching their story, okay? And if you feel that it starts to become more than that, you need to be in the room or outside of work, you need to be able to take that to supervision, and because you're getting overly emotionally involved and absorbed in your job. So, yeah.
I'm sure this doesn't happen, but it's portrayed in movies where people always fall in love with their psychologist.
Yes,
that's like, obviously you guys are trained well enough not to do that. Does that happen in the industry?
It happens, yeah. Look, I think at the end of the day that, the code of ethics is there for a reason, you've got people coming into therapeutic relationships, and it's not, as I said earlier, it's not friend therapy. People are coming into a therapeutic relationships. It's all about the boundary setting. Some people come into a therapeutic relationship with unmet needs. I mean, they might come into a shop with unmet needs, okay? They don't necessarily want to buy something there. They're lonely and they want to chat, okay? So between the unmet need of the client presenting and maybe some unmet needs of the therapist, that's where, you know, that shouldn't occur unless those unmet needs aren't being watched and supervised, okay? So you can have clients present, and, you know, I often say as a supervisor too, and training, particularly females, and I don't want to be gender, you know, because it happened for male therapists too, but say, look, as a female therapist, you know, I was trained, what was incredibly helpful was that, you know, you basically were trained to be, you know, when you meet with a client, it's more of a conservative approach. Be mindful that they could sometimes feel romantically attracted or something like that, you know, because they're feeling alone. You know, they may see you as like a mother figure in their life. They might see you as all sorts of things. So we have this, you know, term like transference and counter-transference in the therapeutic relationship. So that is, you know, the client sees particular things about you, and then you may see particular things in the client that creates a chemistry there. So we need to be able to manage that, you know, and ethically, code of conduct is not to do any harm. So people are coming in emotionally vulnerable. And unless you've got your own linen press sorted, you know, that's how those situations... And I also think they eventuate because people are not going to get their own supervision. They're not being monitored, or they're having their supervision and they're afraid to take that to the supervision space and say, by the way, I've got this interaction with this client. I'm feeling a bit like it's kind of hasn't crossed boundaries, but in the room it feels there's something, you know, how can I work through this? Yeah.
Yeah, great.
Yeah.
Psychologists in Australia are 80% female. What do you think that is?
Yeah, I think in the health professionals as such, there's generally more females, and it's possibly to do with the more, you know, that say all females are more feminine in terms of their personality, caring, and but yeah, I think that's what it tends to attract. It's unfortunate because, you know, when I run groups, I always like to have a co-facilitator that's male. You know, I think, you know, we can't represent both genders, and I'd love to recruit, you know, some male psychologists to the practice. It's really hard. Most of the people that apply, generally, not all, are female. Yeah, or identify as female. So I think it's really I think it's just the nature of health, to be completely honest. But I think that I'm seeing over the years that I think that's the percentage might be increasing a little bit more in terms of more men. It's a shame because men offer, you know, I've got a colleague I know of down in Melbourne. He's got a business called Bloke Psychology, and they're all they're all blokes. They're not against employing women, female psychologists, and that's an incredible space because, you know, some blokes just want to see blokes for therapy.
Yeah.
You know.
Yeah, I understand.
That's right, and some blokes want to see females, and vice versa. So, yeah, but I think it's just to do with, you know, the natural, you know, field of health attracts more females into that profession.
If somebody was thinking about seeing a psychologist, like, how would you encourage them to reach out to someone like yourself?
I would say, I always say no problem's too big or too small. So, you know, because I often find people thinking, is this going to fit for a psychologist? Just inquire, put it, just, you can inquire. So interesting enough, a lot of people email their inquiry through first, and, you know, that's fine because it's a little bit safe, so they can go through the contact us on the website, it's picked up on the back end, or they directly might email. Or they might, generally they'll do that, or might message, you know, through our practice phone. We encourage them to put an email, and then we send them a form just to clarify a little bit more about their situation, because that's one thing I should say is not all psychologists treat everything, okay? Now, you wouldn't know that. The average person wouldn't know that. So, for example, I may not treat like smoking addiction. I may not treat like forensic related issues, and you don't know that until you know, contact and then qualify. So we're not all trained to be a one-stop shop, and nor should we be, because, you know, so the first thing you want to find out is does the psychologist see, and is that in their scope, you know?
Yeah.
They may not see children or adolescent. You know, they may not see people who have an eating disorder. So whatever it might be is find that out first. And that's usually people do hang out on the website or look at, social media and get a bit of a feel. And then I would say, you don't need a referral to see a psychologist, I said that, but if you want to take an advantage of rebates, why not? I mean, if you're eligible for a mental health plan, you get back a significant proportion of the fee. So, sometimes you get 50% off the fee. And, if you go to the hairdressers, you don't get a rebate. If you get your nails done, you don't get a rebate. You know what I mean?
Yeah.
So if you portion it out and go, you're not going to be seeing them every week, it sort of works out fairly, reasonably. But there are services that do bulk bill as well. So you've got to also ask yourself, can I afford this? And if I can't, don't be disheartened, because there are funded services, that do bulk bill. And then I would say you book an appointment and you see how it fits, because finding a therapist is like finding a good pair of jeans. They don't always fit.
Yeah.
All right. And you don't know that until you meet the person, spend a bit of time. The first appointment's always about them information gathering. It's like we can't, fix a problem's not the right word, but manage a problem before we get a bit of a history on it. So some people are quite impatient. They're like, oh, I just wanted to get a solution at this first appointment. It's like, well, I could offer you something, but I'd be guessing, okay? So I'd rather just take an assessment. I'll give you definitely something to work on, to take away. I always give someone something to take away with them, because I think that's important, that they're wanting something. But see how the session fits. And at the end of the session, you say, how was that for you? And I guess in that space, it's about the person feeling safe. They need to feel somewhat emotionally safe with that person they're meeting with, and not triggered by the person they're meeting with. Because if they go, oh, that person was really, I found them annoying, or they kept looking at their watch or something or other, that's completely fine. May not be the right fit for you. You don't have to go back to them.
That's great advice. Where can people find you? Do you want to mention where your shop is?
Yeah,
what your
sure.
Social media is, your website?
Yep, no worries. So we're based in Corio Street, so 187. Corio Street is our office location. So we are co-located within the real estate agency, which is always interesting. People walk in and say, but it's actually nice, because people have a sense of, this is anonymous. Like, I could be walking in here off the street, and though there shouldn't be a stigma.
Yeah, that's great.
It actually works quite well. Everyone in our building is bound by confidentiality. They all have signed a confidentiality agreement, so it doesn't matter what role they're in, and everyone's treated with the same level of respect. So basically 187 Corio Street, Shepparton. We have the website, which is pureempowerment.com.au, and we also have Instagram and Facebook for Pure Empowerment Psychology. The equine empowerment, which is the horse therapy, is located towards Euroa. So it's about a 25-minute drive. But as I said, we do the screening appointments at the office in Shepparton first, and then again, just you go along and have a go at the equine therapy if we think that would be something that would really be very beneficial. We see more blokes, actually, more men out in that space.
Wow.
So
I wouldn't have guessed that.
Yeah. And we also have had people come to us, groups come to us for team building, like team building days, where they want to work on some of their, team-related issues or professional developments at a day, which has worked really well as well. So that's us.
Great. I do have two more quick questions for you. One, you're getting a book published?
Yes, you saw that? It's still sitting in there. So, I'm hoping it'll get picked up by an actual publishing house, but it's pretty tricky to do that. I used to work with a really well-known psychologist in Melbourne, and he's published lots of things and been on This Is Your Life and all those things. And he actually encouraged me he said, you should be doing this stuff, Rachel. But, so I've got a book called The Therapist Effect, and it's what clients really want from the therapy and the therapist, but are too scared to ask. So that book is something I've got in draft form, and I went to a session or a boot camp, a book writing boot camp with Busy Bird Publishers down in Melbourne. So I've just got to be able to carve the time out to actually sit and get it then finished. It's nearly finished, and then actually send it out to be, you know, edited and proofed, etc. So that's really, there's that. And then I've got I've got 4 other drafts of things sitting there around, one working with horses, around, you know, in terms of how the horses, you know, pick up things. As I said before, you can fake it with a therapist, but not with a horse.
Yeah.
And also about for early career psychologists who are thinking about moving to, or just not just early career, but psychologists thinking about moving from metropolitan areas and doing the tree change. I've got a fair bit to share on that, being, you know, a metropolitan born and bred person to start, and then doing the tree change, and how you can make it work in your profession. So
they sound like important books. I hope you do. I hope you push for them hard.
Yeah, I will be. No, I really want to get those out there, so I will need to. I need to actually make that, you know, carve out that time to finish those. Because I see them as helping other people, you know, in different ways.
Yeah. Awesome. And the last question for everybody, who locally inspires you?
I can't come up with one person, to be honest. I would say, I take a lot of inspiration. I mean, my husband's been incredibly impactful in my life. I mean, he's kind of the yin to my yang. He's got a farming background originally, and he's inspirational in terms of what Rod, his name is. But on a broader level locally, I mean, I find the community is inspirational. There's that many people doing their things in this particular community. So many impactful things. And when I go out to different events and meet different people, I just love people's stories. I'm blown away by what, as you would see in what you're doing in this podcast. I mean, I would say the community as a whole, really. There's some, and their response to even the COVID outbreak here just proved that, you know, there's people, you know, the vast majority of people in the community are inspirational in what they do to try and help one another and get through these times. So, yeah.
Definitely. I have to ask, how did you meet Rod?
Yes, interesting. Well, that's my my other passion is horse racing, as in Fashions in the Field. So I used to be quite involved in that when I was in Melbourne, and I still do enjoy it. So I actually met him at a local, or after a local the race meeting at Berrigan, which was in New South Wales. At that time, I was living in Yarrawonga, Mawela, on the border. So when I first moved up from Melbourne, we used to holiday up this way, and I've also got family in Maripna actually. But I met him after the Berrigan Cup. And the rest is history, really. So, and he loves the races as a bit of an outlet. I love the fashions, and I had a local hat lady milliner that I teamed up with that would help us out, because we'd go down to all the full, you know, the race, Oaks Day and the Cup, and do the fashions down there. So obviously that's been squashed since it's all virtual now.
Yeah.
But hopefully that will change going forward. So
surely.
Yeah.
Exciting.
Yeah.
For those people just listening, that's when Rachel's face lit up the most.
Yeah.
All right. Thanks, Rach.
Great. Thanks for that, Holly.